a little bit of information about something we call scratches. And what we're going to talk about a little bit is what it is and how to treat it, as well as how to prevent it. So tonight you're going to be talking about mud management. So what are some of the problems, the big problems with mud? One is a breeding ground for flies, mosquitoes, and with what we're going to talk about, the bacteria and the fungus are what cause the problems. And this mud is just the catalyst for things to develop, such as scratches and thrush. And we're specifically, I'm going to talk about scratches tonight. So scratches is also known as mud fever, pastern dermatitis, grease eel, and dew poisoning, because occasionally in certain areas of the world, we'll see this fungus infection develop due to the dew on the grass that the horses go out into in the morning. But for all purposes, we're going to refer to it as scratches the rest of tonight. So what is it? Scratches is a skin condition or an infection on the lower legs. This infection can be due to viruses, but most commonly it's due to bacteria and fungus, and occasionally there may be some parasites involved, such as mites. But the most common are bacteria and fungus, and this is just a microscopic picture of some streptococcus bacteria. And we oftentimes see this in the winter and early spring because of the mud and because of the wet. Okay. So there are some things that can predispose a horse to scratches. Wet, muddy environments. You can see the horse is standing in water. Mud is splashed up on her legs. And this doesn't make any difference if it's pastures, corrals, paddocks, pens, anything. The other horses that are oftentimes predisposed to developing scratches are those horses that have white legs. Now, don't be complacent if you have a horse with black legs, because I'm going to show you some pictures in a little bit of a pretty severe scratches case with a horse that had black legs. And then also those horses that are heavily feathered, such as some of our draft horses, gypsy vanners, those heavy feathering, actually the feathers get wet and it holds that moisture in, which then just creates a great environment for bacteria and fungus to grow. All right, so under normal conditions, the skin acts as a protective barrier. And essentially what it does is it helps to prevent microorganisms from getting into the horse's system, into the joints, and then traveling throughout the body. So natural skin oils that are normally present in a horse's skin in the winter, they're wet, they're muddy. If you're really, really good about hosing your horse's legs off, that's fine. But sometimes you're removing some of those natural oils that act as a protective barrier. Then when that skin gets wet, it becomes soft and it becomes compromised. So then, as you can imagine, a horse with wet legs, their skin is soft, their hair is wet, they go out in the mud, and mud creates these little micro scratches or abrasions. And what happens is those abrasions are then an open door for those microorganisms to enter into that skin location. On this picture, one thing I wanted to point out to you is this is that horse I was telling you about, and actually this was my mare. This was her, and I could not figure out why she was stocking up, because you can see she's swollen and puffy through this back fetlock area down into her pasterns. And I couldn't figure out why. And so then I got to digging and feeling, and she had scratches. And believe it or not, she actually had scratches clear up to the base of her hock. We're going to see some pictures as we go through. I ended up having to completely shave her legs, clear up to the hock and clear up below the knee, because she had them on all 4 legs. And it took me about 3 weeks to get her healed up. And so don't get complacent if you have black-legged horses, because really they are as susceptible to scratches as what a white-legged horse is. So again, the wet conditions that we see during the winter, or because of the dew, that causes that barrier to break down, and these microorganisms can start to invade the skin. They create infections. You can see here, this is that little mare I was talking about. When I really started looking and started cleaning, you can see the patch right here where the hair is actually gone on this white-legged, white pasterned horse here. You can see this whole area is hairless. The other thing that you're going to notice, and we're going to see this skin is really, really irritated. You can see how bright pink it is. And that's some irritation. And I'll give you some ideas on what you can do to help these horses. So there's about 3 degrees of infection. The first one is mild, where the legs are a little bit crusty and have some flaky skin. Moderate is where we start to see hair loss and the beginnings of open sores. You can see on this horse right here, we've got open sores, and then extreme. This is where the skin is really inflamed. It's red. We can see some swelling, and they can actually almost start to develop kind of almost these canker-like growths on their legs. Sometimes these horses are lame. And as you saw in that picture a couple slides ago, there's the swelling and the stocking up that we can see with the development of scratches. So we kind of talked about some of the symptoms already. So some of our first symptoms, we've got the swelling, the puffiness, and then if you start looking, so this area on the horse's leg, so the back of the pastern, and then the divot right up and in between the hoof bulbs, because the heel bulbs are right here on this horse. And so that little concave area in between the heel bulbs, that's a really good area to watch. And you can see there's hair gone up in through here and up into here. There's some over here. And the crusties, real scientific term there. The crusties, you're actually going to feel like little scabby pustules in these areas. And it's one of those things, when you feel them, you know what you're dealing with. So as these progress, if they're not treated, they can develop into big weeping crusty sores like what we see on this horse. If left untreated, you can kind of see the skin is starting to crack right here. If these are not treated, they can crack, they can open up. They essentially make this horse more susceptible to even more bacterial and fungus infections. And then chronic cases can develop these granulomas, which are just big, huge, like I called it a canker, big foreign bodies that can develop if these are not taken care of. So how do we treat these horses? First step, they need to stay clean and dry. That is the first thing you need to do to get these horses on the road to healing. So get them out of the mud, get them out of the water, and they need to be in dry pens or dry stalls. You can use scissors or clippers, and you want to clip that hair pretty short, okay? Clippers are not advised if a horse has open sores, as some of the tiny cuts, pieces of hair can get into those open sores. But you can see on this is kind of a progression picture I took. Right through here is I have her shaved, okay? And just as an example on her, I tried to get her healed up without shaving her, and I wasn't making any headway. And I had to shave her. I had to get that extra hair off of her, so I could actually get to these sores, to the pustules, and get her clean. One other thing to remember is a lot of the bacteria in particular are anaerobic, and that means they don't like oxygen. So what they do is they get behind the scabs, and that's where they sit and fester and hang out. So what we want to do is we want to wash this area. You can use like mild soap such as Ivory dishwashing soap. You can use betadine. My favorite thing to use is chlorhexidine gluconate surgical scrub. That's something you can get from your vet. And you're going to scrub these legs, but the thing is, you don't want to scrub and scratch. You actually want to be really gentle when you're scrubbing up these legs and getting them all sudsed up. And a lot of times, like with the chlorhexidine gluconate surgical scrub, you're going to let it sit for about 5 minutes. And you want to soak off the scabs and the crust. Don't pick at them, okay? Because you don't want to increase inflammation. But we do want to remove those scabs, because if we remove the scabs, we expose that bacteria to the air and we kill them. And so that's ultimately what we want to do. We want to expose the bacteria and the fungus to the air so they'll die, but yet we don't want to pick off the scabs, okay? How many of you had mothers who said, don't pick that scab? Have her talking to you as you're working on these horses. Then you want to use clean towels. And one of the things is you want to dry the legs thoroughly, but be careful about doing this, because you may actually start to aggravate. And if you haven't gotten all of the little granules out of there, you can actually create more cuts. So dry with the leg, or if your horse will tolerate it, which it's really surprising, a lot of horses will tolerate a blow dryer. Okay, so just go grab your hair dryer out of your house and blow dry the horse's legs off. Okay, horses actually really like it. The little mare that I've been showing you guys pictures of, she would actually fall asleep while I was working on her. So, you know, there's different ways we can get that moisture off of the hair. Then what you can do is, if you see signs of infection, that's these little yellow pustules, that the skin is inflamed, okay? It's bright red, it's aggravated. There's a couple things we can do. You can use an antibacterial or triple antibiotic cream, such as Neosporin. Here's one by a company called Healing Tree. This one is really good for working on scratches. This picture in the upper right-hand corner here, this, after doing some research and snooping and educating and trying this and that, this is actually an ointment combination or concoction that I came up with myself. It's one tube, and essentially we do this in a 1-to-1-to-1. And so we have AD skin protectant, which has a lot of lanolin in there. This helps to soften those scabs. And so you wash, you treat your horse tonight, tomorrow night, there's going to be more scabs that come off. Anti-itch cream, hydrocortisone. This hydrocortisone is going to help to take that inflammation and irritation out of the skin. So it's going to take the itchiness away. It's going to take the inflammation away. And then we come in with triple antibiotic ointment to start to get the skin to heal. Okay. And please feel free, if you guys want to make this, I literally squeeze all the tubes in a little jar, mix it up and put it on, and it works great. We actually use it on all of the horses here at OSU in the winter. Then you can use Desitin. You can use Corona with lanolin or Vaseline. I do want to caution you though on doing this. The horse's legs, if you do this, if you use like Desitin, which is just diaper rash cream, Vaseline, if you use this skin and hair has to be 100% dry. Because if this area is not 100% dry, now what you've done is you have locked in the moisture and you've locked in the bacteria back into that nice little anaerobic environment again. So I do caution about putting on these top layers. And every day, at least once a day, you want to rewash the legs, re-dry the legs, retreat them, okay? If you can do it twice a day, great. But minimum, do this once a day. Some of these horses can actually get sick enough that they have to be put on broad spectrum antibiotics to completely heal and take care of the problems. And so be proactive rather than reactive when it comes to working on treating your horse. So how do we prevent this? Keep the horse's legs as dry as possible, but we all know in the Pacific Northwest, having horses, keeping them dry is virtually impossible. So what you can do is wash the mud off their legs every night, and then dry those legs. Okay, whether you take a towel to them, whether they go in a box stall, just try to get those legs dry so they don't sit there and stay damp all night long. And check your horse's legs regularly. That's a big thing. You know, get down, get up underneath the hair on the fetlock, feel down into that little divot right above the heel bulbs. Look for pink skin, anything like that. Look for, you know, swelling you can't explain. So there's a lot of different things that you can look for to try to help with the situation. So I hope that gives you a little bit of an idea on scratches and how to treat and how to prevent them. And Melissa is now going to do a deep dive into mud management and what you guys as horse owners can do to help reduce the mud on your property and help to manage the mud. I hope you have a great evening. Bye.